Director, MMC technologies to make sure that we provide quality healthcare services to our people. And of course, to the patients. And without saying much, I just want to confirm that as a department, we commit to maintaining and looking after this very beautiful facility, and that we will keep it in good shape and make sure that at all times it's restored to its firm, and assure you that all the donations you have made will be kept accounted for and make sure that they serve the people. Now, ladies and gentlemen, without any waste of time, I'm going to introduce to you our Premier, Premier David Makura, the esteemed Premier of our province, David Makura, to deliver a keynote address marking this very important event today and to address us. Thank you very much.
Program Director.
Thank you very much to the Program Director. I would first like to acknowledge the two MEC to go. There's work we are doing at George Mukhari Hospital and at Jubilee Hospital, similar work of upgrade of our health facilities. Some of that work was stopped by the business forums, so she is going back to attend to that. I want to acknowledge the Mayor of Johannesburg, Mayor Jeff Makubo. Mayor, we are in your city, in the southern part of the city of Johannesburg. I want to acknowledge the MMC, our social partners from the Steyn City Foundation, who have joined us today. We are very pleased with the quality of beds you have donated to this facility. It's somewhere hidden amongst you there, but you would know he's the one who was taking us around. Dr. Madi is the acting CEO of this district hospital. All the senior officials, including the representatives of the trade unions, I saw some of them are with us here today. Today is the 18th of September. Many of you would know that we have done regular briefings and updates about COVID-19. We have done weekly updates. A community health clinic from a clinic into a full district hospital. We're linking the briefing, weekly briefing, with it principally because a lot of people who are COVID positive, there are a lot of people who quietly to fight keep the infections low, we gear up our healthcare system. Yes, there was a period where we were very concerned with the peak. What happens at the time and rehabilitate and refurbish and re-gear and repurpose our entire healthcare system for many months and many years after COVID-19. So for that reason, we as the Gauteng provincial government have dedicated a lot of attention to the existing facilities. So the story of fighting COVID-19 in Gauteng is not only what we did when the infection rate was high, but do not have a hospital. If we need to go to hospital, we must either go to Sebokeng Hospital or we must go to Chris Hani Baragwana. Some of the things they pointed out to me was our clinics are also very small, and we upgraded one of the clinics at Ennerdale. We upgraded the clinic, but they kept saying that big hospital. We said to them, we are going to go back and amongst the plans we had was to turn this old, this was a community health center, to turn it back. At some point, it was a hospital. in the 80s, but that we will upgrade it into a full functional hospital. One of the things that COVID-19 did was to put lots of pressure on us. So we had plans to upgrade 31 hospitals and community health centers in 5 years. That was our plan of this administration. We were not ready to do it as quickly as we have been able to do this. We were going to convert this clinic into a hospital over more years. It was going to take us another 3 years to actually do the work. So COVID-19 came, and when we assessed the landscape of our province, we said, firstly, we need to put more resources into upgrading, adding more beds and repurposing and refurbishing more existing hospitals. So our first priority was to go to the current hospitals and say, in which area in this hospital can we add 40 beds? Can we add 100 beds? Can we create an ICU with additional 20 beds? We did that in Tshwane. We did that in Johannesburg. We did that in Ekurhuleni. We did that in Sedibeng. We are also doing that in the West Rand. So today, as we turn Lenasia South Clinic into a district hospital, I am very glad that there are things we will ask. He is very happy. They have also received new equipment, the state-of-the-art beds, but also the state-of-the-art machines, including X-ray machines, the comprehensive care here, which was not possible. They used to refer a lot of patients to Chris Hani Baragwanath. Yes, they will still work with Chris Hani Baragwanath, and the professors at Chris Hani Baragwanath will also be able to come here. In addition to the number of beds, we also want to say to you, we want to add more medical staff, more healthcare professionals here, because healthcare is not just about the number of beds. It's the quality of care facility. And I am glad to say that in addition to that, in addition to more human resources, we want the state-of-the-art technology to be added here. So you can see this is an old facility, but the renovations that were done here are fantastic. And I got feedback from that there are things that they never used to be able to do here. They always envied their counterparts in other hospitals, but they are very happy that those things will be done at this hospital. I want to say also, that more than 500 ICU beds in different hospitals which are now operational in Gauteng. We have also added 1,200 general beds, but that we are not over with that. So we have added more than 500 ICU beds that are currently operational. We have added more than 1,200 general beds that are currently operational, but we are not done yet. In addition to those, we are adding through what's called alternative building technologies. In our current hospitals, we are adding an additional 1,500 beds. So our approach in Gauteng province in dealing with COVID-19 has always been, as we deal with the preparations, we'll say we now have a hospital. The people of Region G in Johannesburg will say we used to have a clinic. 103 beds that are here have oxygen points. Just in case you don't know what that means, for someone like me who has gone through COVID, so these beds in this hospital, we did not have beds with oxygen points. We now have oxygen points. You know, COVID is a disease that attacks someone's breathing ability. It also, at times, the doctors will tell you, breathing problems are one of the major manifestations of COVID. So we will be able to treat COVID patients here on those oxygen points. But this is also beyond COVID. It's a very, very important intervention to make provision for full medical care in an area of our province, the south of Johannesburg, where there was no hospital of this capacity. So I also want to say that, so we are continuing. I am putting a lot of pressure on the acting MEC for health and the MEC for infrastructure. I'm putting lots of pressure on them. Let us continue with whether the peak will come or not. We still need good medical care. So we are continuing to do basically three things across the province. So we are continuing to add more beds in the existing healthcare facilities. Secondly, we are continuing to increase the number of staff. We are continuing to add more healthcare workers because COVID taught us an important lesson. Our healthcare workers have done a great job. They are our heroes and heroines. But they were coping, their numbers, there was a period in July when the hospital numbers were very high in Gauteng. There was a period where we had 7,000 people in hospital at one time at a go. And the healthcare workers, the number of hospitalizations were increasing. Our healthcare workers had it very, very tough. So we are also, in response to the call by clinicians, we are increasing the number of healthcare workers. So we are increasing the number of beds as we refurbish, but we are increasing also the number of healthcare workers. Thirdly, we are also increasing the technology, the health technologies. The hospitals that did not have adequate equipment, including state-of-the-art X-ray machines, are getting that. So one of the things, this hospital, As I speak right now, this hospital is getting the state-of-the-art X-ray machine. It's being installed as I speak right now. This morning, Dr. Madi showed us the team of technicians who are installing the state-of-the-art X-ray machine, which will be able to serve the people of the south of Johannesburg to diagnose certain ailments that could not be diagnosed here before. So, in terms of our health response, what is my message today? We are continuing to improve our capacity. Even if we were to have a second wave, even if the second wave does not come, we want better healthcare facilities. So we are continuing to do that. But I also want to say to the people of our province, we thank you. There are many times we were worried about your behavior, but today we can say many more of you are complying with the health protocols. Many more people are having their masks whenever they leave their homes. There are more people in Gauteng we find in public spaces wearing their masks. Let's give our people a big round of applause. They must continue with this practice. Even though we have gone to level 1, we must continue with the practice of wearing our mask. We must also continue to sanitize. We must also continue to social distance. We know the president, in announcing level 1, the funeral numbers will be 100. They used to be 50. But I must tell you, I am worried. Even with the 100, let's make sure that the funerals do not become the place where COVID-19 infection increases are going to happen. There are also meetings allowed, indoor meetings and outdoor meetings. Let's continue to sanitize. Let's continue to wear our masks. Let's continue to social distance. COVID-19 is not over. We are doing very well in reducing the numbers, in containing the spread. Johannesburg, you have done very well. There was a period where COVID-19 in Johannesburg was totally out of control. So to the leadership of the city, I want to commend you. Mayor, I know you spent sleepless nights. We had huge infections in the north, and those infections moved to the center, the CBD of Johannesburg, the inner city of Johannesburg, and they moved to the south. They were in Soweto, in Orange Farm. They moved to the south, Lenasia, Enedale. But we send our workers, healthcare workers, to work with communities. We got our municipalities to really do tremendous work to mobilize communities to send through these messages. As we speak today, Johannesburg is doing extremely well. I am happy with the number of recoveries in Johannesburg. I am happy that there's containment. There was a period when Soweto was a big concern for us. Soweto used to be a very big concern for us. The CBD used to be a very big concern for us. The northern areas, particularly Ivory Park, was a big concern for us at some point. We are not over it. We have it under control. Let's continue to work daily with our people to call on them to sanitize, to social distance, and to wear their masks. What am I worried about? The numbers in Tshwane are much higher than they have ever been on COVID-19. Because there was a period where we were worried, very worried about Johannesburg, and then we got very worried about the west of Gauteng, the West Rand, what was happening in the mines. We got worried about parts of Ekurhuleni. We got worried, and we deployed lots of resources working with the municipalities, particularly the grassroots healthcare workers. But today, I'm worried about Tshwane and Sedibeng. So the COVID numbers in the last 2 weeks, although the numbers are going down significantly, we have reduced the spread of COVID, but relative to where things were, MEC Mamabulo, I will say that we need to send our troops to Tshwane and Sedibeng. If you look at our regular reports, 14-day reports would show that if there are places we must worry about, it is those places, the northernmost part of Tshwane, the eastern part of Tshwane, which is Mamelodi, and the central part of Tshwane. We must also worry about Sedibeng. The areas in Sedibeng will be Sebokeng and Everton. We will be worried about that. Yes, we are moving to level 1, but we want to continue to be vigilant. We don't want the second wave. We don't want to find ourselves in the peak we went through in July. We can only do so by being vigilant, by working hard, by being on the ground. So we share with you the number of daily cases per week. It continues to go down on average to below 400. I know a day or so ago we got 400 infections, but on average, the daily cases on average are at 300 cases. It is important that we continue to reduce the number of cases. We share with you again the good story about the sub-districts is really the number of recoveries. If you look at the sub-district in Johannesburg, the number of cases and the number of recoveries are almost at the same level. The same thing with Ekurhuleni. I'm very happy the number of cases and the number of recoveries are almost at the same level. But there are certain areas, as I've said, in Tshwane and in Sedibeng where we should be worried. So I want to conclude by saying we are continuing to fight the scourge of COVID-19. But we are also continuing to fight the scourge of gender-based violence, another pandemic. In this province, we have seen the impact of COVID-19 has been disproportionate. The actual number of cases, there have been more women who had turned positive case by case because of their vulnerability, because of their exposure, although more men have passed on if you are counting fatalities. But we know the impact of gender-based violence has been huge. I also want to say, as we deal with COVID-19 and deal with gender-based violence, we must deal with another pandemic, the pandemic of corruption. Corruption undermines every little good thing that we do. Everything we do for our people, new facility we build,
if there's corruption in that facility, it just eats away the positive things. So we must confront corruption with the same determination and the same zeal that we have faced the virus, that we deal with gender-based violence. So as we roll out these facilities, as we build more infrastructure, I want to assure you, the people of Gauteng, that in each project we are also making sure that the investigations, there are investigators who are watching if any corruption happens in any process of building our facilities or refurbishing our facilities or buying PPE for our healthcare workers. There shall be consequences. The Special Investigation Unit is hot on the heels of those who did wrong things, who got involved in corruption of PPE. They are not going to stop only with PPE. Corruption everywhere in the course of this process of fighting COVID-19. If there's anything that went wrong, people this time round are going to go to jail. And this time round, we want to see people going to jail. Because when we say we are building houses for our people, we want South Africans to believe that that is done for our people and there's no corruption. When we say we are building roads for our people, we want South Africans to believe that that is roads that are built to improve access and the quality of life, and there's no corruption behind that road. Everything we do, we are building schools, everything we do must be done genuinely for the benefit and for the improvement of the quality of life of people. So those who are involved in corruption must know that their days are numbered out of jail. I, as the Premier, awaits the reports, regular reports and regular update from the Special Investigation Unit. I'm waiting for the next update. There are 40 companies and individuals who they identified. They've frozen their accounts. I'm waiting for the next report about what has happened. So, as we hand over this facility, acting CEO, we want this facility to be run free from all acts of corruption. This must be about saving lives, because health is about saving lives. We want this facility to benefit the people of the south of Johannesburg. So I thank you very much, and I want to say to the people of this area, when you said you wanted a hospital, I know there's another thing you also said you wanted. You said we must continue to upgrade your clinics. In addition to the clinic that we upgraded in Annandale, we've got a full program of improving health infrastructure in every part of Gauteng. So we will definitely make sure we follow up on this. So MEC Mamabulo, I want to be so proud of the health services here that if I am sick, I must be able to be admitted in our healthcare facilities. As government officials, we must use these public healthcare facilities. I was using the public healthcare facilities during my COVID time. We must use these facilities, all of us, also as a statement that we are building them and they are good enough to serve anyone who is not well. So thank you so much we now have this place, which used to be a clinic, declared a district hospital. It will serve the people of the South. Thank you very much.
Thank you very much, Premier. I think for sharing also the history of this facility. I must say that I am quite delighted and proud to serve as part of this leadership and government that is truly listening to its people and that is swiftly responding to the needs of our people. Thank you very much also, Premier, for also emphasizing the point that COVID-19 is actually still here, it's not over. It is still quite critical for our people to continue adhering to the golden rules of wearing their masks, washing their hands, and social distancing. I hope that Gauteng residents are listening to our Premier and will continue to do that. Let me also acknowledge the presence of our Provincial COSATU Deputy Chairperson, Comrade Tabang Sonyati, who's also amongst us here, and I've seen as well representatives of DEMOSA, NEHAU, and the PSA who have also joined us here today. I thought it's important that I also recognize the presence of our fellow colleagues. I'm going to, I'm told there's also Hospesa that is also amongst us today. You are welcome to our program. We are almost at the end of our program. We started quite early, hence we will be closing in a few minutes' time from now, but we'd like to thank all the representatives who have spoken before. I'm not going to take your responsibility, acting CEO, who will be doing the vote of thanks for us for our event today. I'll call upon the podium Dr. Madi, who is the acting CEO of this district hospital that we are at this morning. Dr. Madi, the platform is yours, sir. Thank you.
Program Director, thank you very much. Can I first acknowledge the Premier of Gauteng and the MECs, the acting MEC for Health, Ntate Mamabolo, and the Joburg Mayor, Mr. Makubu, and then the other dignitaries. I'll also want to acknowledge the presence of organized labor. We are grateful that you are here. This facility has been like moved up and down. Like initially it was a hospital, it became a CHC, just a clinic, and then now it's a formal small district hospital with about 103 beds. Initially the plan was that the 103 beds were going to be committed to COVID-19 patients. But looking at the figures that are coming down now, we decided that we are going to return to the previous functionality of the hospital, having some of the beds as just general medical beds, and our MOU as well. and the casualties. My job here now, it's simple. I am here to just thank everybody who's here, who have attended this gathering. And I would like to also thank our sponsors and thank our staff, the management staff of Lenasia South and the general staff of Lenasia South. Some of them were very inconvenienced by being moved around to other facilities in order to give way for the renovations. So I say that thanks very much, colleagues. And by the way, it's so difficult not to talk about COVID in any platform because that's our main problems. Some of these beds, if we do, Premier, have the second wave, but other academics in the meeting that was held about 2 weeks ago in Joburg, they were saying to us that there is no likelihood that our facilities will be stretched. They believe that they were able to manage within the resources that they had. They are predicting that chances are this second peak may not necessarily be higher than the first one. But yeah, and fortunately in the institution, we only had about 42 staff members who were infected, and we had 100% recoveries. So we are grateful for that. So I would like to salute the frontline workers. They've done well, although we're not yet over, we're not out of the woods yet, but I think we are more than ready to face the second peak if it does come. Yes, so we would also like to send our condolences to all those who actually lost their lives during the line of duty. Yeah, basically what I'm saying is that thank you guys for gracing this occasion. Thanks to the Gauteng government. We acknowledge that your commitment as government of providing high quality health care, you are actually delivering. Prima, you promised people in this area that you were going to give them a hospital. Now we have the hospital. I'm not sure if some of the community members are here. We want you guys to protect this facility. It's yours. And there's no need to bend tires outside. You can come in, let's talk. Whatever issue you have, come in, let's talk. Don't bend tires outside. So, by the way, Premier, this facility was functional before as a hospital. We're using those beds as medical beds. We stopped functioning when we gave way to the renovations in March because we were trying to prepare for COVID-19 patients. But I can tell you, Premier, that at the time we were giving service before COVID, already the community were acknowledging that this facility has helped them a lot. Because if they had their family members sick, I mean, the guys from the neighboring, like the 5 to 5, it's the community around here, they say, no, we are happy now. We can just walk and see our family members. They didn't have to take about 2 taxis to Begimlangen. They did acknowledge that. So what I can say now, I will say thanks to everybody who is here, everybody who supported us, and thanks to the senior managers from the district health, and then that's it. We are very happy and hoping that this is not the last time government comes here, because we are still going to have a lot of challenges. We are hoping that we'll be able to pick up the phone and talk to you guys, and hopefully everything will be sorted. Thanks very much, colleagues.
Thank you very much, Acting CEO. I think the community is here and they've heard you. They will definitely not ban this hospital. Yes, colleagues, we are at the end of our program. The acting CEO was the last speaker on our program. I think I would like to thank all of you. You've been great audience throughout the program. Let's continue to observe the golden rules, social distancing, washing our hands or sanitizing, and as well as wearing our masks. You are now dismissed from this particular gathering. Thank you very much. I'll request that inside the tent, we are left with our dignitaries who are sitting right here in the front, and all of us, we can be excused. Also, media as well can remain inside for interviews with our dignitaries. Thank you very much, everyone. God bless.